Good evening, Professor Henderson and my classmates. I thank you for stopping in and checking in on this video. I wanted to discuss a common condition and an encounter that really changed my perspective. And the condition I wanted to discuss tonight is GERD. Um, Historically, my understanding of GERD and the way that it manifested had always been very mild and often overlooked, as most of the patients that I've treated with GERD either don't have severe symptoms, or it's non-existent, or they're non-compliant, and therefore it leads me to believe that they may or may not need the actual medication or treatment. But I had an encounter this last week with a patient who was quite opposite of that, from which I'm historically used to seeing. She was a younger female, and her symptoms really kind of had me throw all of my assumptions about GERD out, and it really gave me an opportunity to look at it with a new lens, and to listen, and to care really from a holistic position. So a little bit about the case. She was a 30-year-old Hispanic female, and she came in because she was presenting with a 3-month history of heartburn, gas, and really just waking up with this throat burning sensation at night. And so she said it started off very mild, and she would use calcium carbonate, Tums, and Tums were effective for a little while, but the condition seemed to progress, and then just became very persistent, right? And with symptoms occurring daily and getting worse. And so she said she experienced this gas and this bloating, and she'd gotten to the point where the symptoms became so severe, she stopped eating dinner. She modified her entire diet. She was saying that the burning sensation at night was interrupting her sleep, and she was here in the clinic because she said, she's lost 9 pounds in the last month, and really that was starting to concern her because she just didn't feel like herself. And so yesterday she reported that her voice was raspy because of the constant burning. And so it was important that I started with the working diagnosis of GERD, but it also kind of got my mind going to work out a H. pylori infection as well as gastritis as the differential diagnosis. Why this case was meaningful to me, because it really challenged probably the unconscious bias I had about GERD and how it affects people, how the clinical manifestations were actually different from how this young lady presented in the clinic. Like I said, historically, I've seen it in older patients, and it either was very mild or it was non-existent. But to see a healthy young lady come with such debilitating symptoms, it really kind of opened my eyes to how serious this condition can be, right? Because not only did it affect her physically, but it waned and on her mental wellness, to the point where she just was not comfortable in her own skin. And so the amount of distress that she experienced it really stood out for me, because she wasn't just uncomfortable. She was to the point where she was scared, and she expressed that that's what brought her in. She couldn't sleep. She was losing weight, and now her voice was changing. And so it really kind of let me know, it kind of like set off an alarm, so that I can listen to this person instead of just looking and trying to determine a plan based off her symptoms. It gave me the opportunity truly just to listen. So when I'm thinking about this case, I was thinking, it seems like GERD, but what if it's not? what really stuck out is the unintentional weight loss, and obviously the reliance on the calcium carbonate. She was taking those things like they were vitamins or candy. And so those were the red flags of just going, this is GERD and GERD alone, because I didn't want to miss something. So I developed a differential diagnosis of H. pylori and gastritis. The evidence-based evidence guidelines I used was ACG for GERD guidelines, Cleveland Clinic, NIDDK resources. They help support my decisions. And really, they emphasize those alarm symptoms like weight loss to support getting EGD done. So I got a comprehensive lab workup, right? The excessive use of Tums led to CMP because it's important that we check them calcium levels as well as renal function. And so a lot of education went in about the nocturnal burning, the post-meal symptoms. And so I started her on a PPI, which is the first line treatment. And we started at 20 milligrams to be taken before breakfast. She was provided education on her diagnostics as well as lifestyle modification. And the plan was really to see her in 4 weeks. Holistically, I wanted to make a conscious effort to approach this case probably in a different way than just seeing, like I said, as a symptom. I didn't just want to assess and see what was happening physically, but rather her symptoms and the way that she opened up really allowed me to see how these symptoms and this condition was affecting her life. I thought about her sleep disruption. I thought about her work routine, and she said that she pretty much spends the majority of her day sitting down. She has a very sedentary lifestyle. How her eating pattern was affected, and how she was concerned about her weight loss. And so education became a big part of this visit because it helped bring knowledge to places and spaces where she was confused or fearful. And so it helped her to really kind of get an understanding of the plan of care moving forward. It seemed to to empower her. So where the things that she could control, like when to eat, when not to eat, what to avoid, and then really just kind of carefully explaining the steps of treatment, kind of made it, empowered her to drive the care that she was desiring. And so I really just listened to her, listened, and really heard what was her major concerns, and really wanted to support her care based off what she said, right? And so regarding Gene Watson's caring science, I try to put it into practice because it really guided the care. I wanted to help her by developing a trusting relationship. I wanted to not just hear her. I wanted to listen to her, and I truly wanted to come from a caring, compassionate perspective. So I was intentional, and I slowed down, and I was quick to listen and slow to speak. I didn't want to interrupt her. I let her express her fears, and instead of just going into this is how we fix it, I wanted her to come along the ride because it's her care, and we have the opportunity to come along beside our patients. And like I said, this case really just kind of put me in the proper perspective, and it created a space where she was safe, and she felt empowered by driving the care. And so in closing, the case reinforced to me that, advanced practice nursing is not just about getting the right diagnosis, but seeing the whole person, right? Seeing their condition, seeing, looking beyond just what's common, but also integrating science with compassion. And GERD is not just heartburn, right? It's more than that. It's the person that's living with it. To slow down, to listen to each person, and really to to be able to bridge the gap from their fear to their need, not just scientifically, but on a holistic level. So thank you for your time, and have a wonderful night. God bless.